Oh, good morning. Thank you for joining us. We're gathered here today on Treaty 6 territory, and I want to acknowledge the Métis people who share a deep connection with this land. I'm joined today by Lori Harsh. Lori's lifelong friend, Deborah Williams, was diagnosed with cancer in December and is still waiting to see an oncologist. For the past 3.5 years, our healthcare workers have been under intense pressure as they navigate the challenges of a health crisis the magnitude of which we have never seen in our lifetimes. At the same time as a global pandemic was descending upon us, the UCP government declared war on doctors and refused to stop in the midst of that health crisis. Albertans seeking care and those who provide care are paying a hefty price for their deliberate decision to attack doctors, coupled with the UCP's incompetent management of health care in our province. A vast number of Albertans are without a family doctor. Dozens of rural hospitals are partially closed because of staff shortages, and ambulance delays are getting longer and longer. The UCP's caustic relationship with healthcare workers has driven many to leave Alberta, change professions, or retire early. For those who remain, the UCP's belligerent mismanagement of the healthcare crisis has left them battle-weary. Alberta's healthcare staff have been pummeled by a lack of respect, a lack of support, and a lack of resources. They are not to blame for this crisis in healthcare. But rather than taking responsibility and working to end the crisis, Danielle Smith has blamed the AHS staffing shortages on those her government failed to support, in order to respect or to provide the necessary resources for them to do their jobs. As Dr. Paul Parks, the president-elect of the Alberta Medical Association, an emergency room physician in Medicine Hat, recently said, and I quote, "AHS is the people and the human beings that are in that system and that make it work." Does the Premier think I'm the problem? Does she think that the nurses who are working unbelievably hard, are they the problem? End quote. An Alberta government should not be at war with healthcare workers, and it should definitely not be making an extremely challenging health crisis worse. The fallout of this government's decisions has been devastating for healthcare workers and for those seeking their care. And to share more about those impacts, I would now like to turn things over to Lori.
Thank you, David. I'm here today because Deborah Williams went to the hospital with extreme abdominal pain, and after tests on November 26th and 27th, she was diagnosed with cancer. On December 18th, Deb was told a biopsy confirmed it was carcingiocarcinoma, a rare and aggressive form of cancer, and that would be 6 to 8 weeks before she could get an appointment to see an oncologist. On January 5th, Deb received a letter from the Cross informing her that her new patient referral had been accepted and she was on a wait list for an appointment. A few days after the letter arrived, Deb got a call from a worker at the Cross to confirm that she's on a wait list, and because of a quote-unquote backlog, it would likely be 8 weeks before she saw an oncologist. It's been nearly 3 months since the initial diagnosis of cancer, and Deb is still waiting to see an oncologist. Until Deb has an appointment at the Cross, and until she's assigned an oncologist, absolutely nothing happens for treating her cancer. We haven't even been able to get anyone to talk to her about her cancer. When Deb was released from hospital, there was a home care worker coming once a day to clear a drainage tube. She needed more complex care, so Deb has been at the Grey Nuns on the palliative care unit for about a month now, and she waits for the consultation with an oncologist. She's trying to get strong enough to leave the hospital, to perhaps be strong enough for treatment. But as the cancer progresses, it's a goalpost that moves further and further away. The medical staff are wonderful. They've been supportive and done everything they can for her, but they can only treat her symptoms. Nothing is being done to treat her cancer until she's assigned an oncologist at the Cross. Deb just wants to know where she's at with her diagnosis, what treatment options, if any, are available to her. But she can't get any advice or any options, any discussion about the disease that's attacked her. I've done a lot of research on this now, and I've even talked to a survivor of this rare type of cancer who were told it was inoperable but demanded treatment. And for one of the people I talked to in Ontario, that was 7 years ago, and she's still alive and living her life. I've also talked to someone who's 14 years post-surgery, who was also told their cancer was untreatable. Deb just wants to see an oncologist and see what she is facing. She's stuck in limbo, and it's just not fair or humane. We're waiting by the phone, and I'm going to her house every day to check the mail in case there is something from the cross. Deb deserves better. We don't have enough doctors. We don't have enough oncologists. The way our system has been decimated, I don't see that changing anytime soon. With the climate in this province the way it is towards the medical community, who in their right mind would want to move here? Deb and I have been friends for 53 years. We met in junior high, and we've stayed in each other's lives ever since. Deb's husband died of cancer 15 years ago, and her only sister, her only sibling, passed away in December. She has 2 grown sons who are doing everything they can for her, and I'm retired, so I'm able to spend 2 to 6 hours a day at the hospital with her. Deb has accepted that this cancer may likely kill her. She just hasn't accepted the fact that she's not even given the opportunity to meet with an oncologist and have a discussion about what is happening to her. Deb's already planned and paid for her funeral. She ordered her urn off Amazon. I took it up to her on Tuesday to show it to her. How did our healthcare system get to the horrible state it's in right now? I'm so angry, and I'm afraid. I fear for the future of healthcare in our province and for Albertans who expect it to be there for them when they need it. I'm here advocating for Deb, but Deb is advocating for all Albertans.
Thank you, Laurie, for being here with us today. It's heartbreaking to hear what Deb is going through, and she must be so appreciative to have your love and support. Unfortunately, Deb's situation is not unique in Alberta right now. People have reached out who have been waiting up to 8 months to see an oncologist. Laurie told me that unless a situation like this impacts you or a loved one, it can kind of fly under the radar. She wants Albertans to know this is happening in the hope that our healthcare system can be fixed. I know family members, friends, others who have been diagnosed with cancer, and it is a scary diagnosis, but it does not have to be a death sentence. Deb just wants to meet with an oncologist who can tell her what's happening, if the cancer can be treated, what to expect. But there's a backlog. And Laurie's fear is that Deb will never have the opportunity to have that crucial meeting. Now, Danielle Smith is not a leader who inspires confidence that her UCP government even knows where to start in fixing the mess that they've made. Albertans deserve care when and where they need it, close to home. But we can't trust Danielle Smith and the UCP with health care, and we can't just hope that one day this will sort itself out. Deb and unfortunately many Albertans cannot wait for one day. They cannot continue to wait for the help that this government is spending thousands of our dollars telling us is coming. We need a plan, and we need a government that we can count on and trust to execute that plan. This past Wednesday, I stood with Alberta NDP leader Rachel Notley as she said we need a new approach and announced our vision for primary care called Family Health Teams, a plan that will allow 1 million more Albertans to be able to see a family doctor or another member of a family health team within a day or two close to home. A family health team can include multiple family doctors as well as nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech-language therapists, and many, many others. When you walk into a family health clinic, you'll immediately have access to a range of primary care professionals who can help you respond to a problem, manage a chronic condition, generally support you in maintaining good physical and mental health. That means less waiting, less running around to referrals, less repeating your story to one new person after another. Family health teams mean one location to get your family health concerns looked after. And here's the thing. When Albertans can get the care they need, when and where they need it, close to home, that will take pressure off of our hospitals and emergency rooms. That means we'll have more capacity, more support for folks like Deb. We are also committed to launching the largest, most ambitious healthcare recruitment campaign that Alberta has ever seen. We must take the strain off our healthcare workers so that our healthcare system can work for everyone, can be there for Albertans when they need it. We cannot accept that people who are diagnosed with a potentially life-threatening illness are sent home to wait for months to see the specialist they need to see. An Alberta NDP government led by Rachel Notley will end the crisis in our healthcare system. Thank you, and we're happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function to get in the question queue. On the phone, it's *9, and we'll start in the room.
Mr. Shepherd, in the last 3.5 years, what has changed at the Cross? Like, do you have any numbers that you can point to that says things are different at the Cross? Is there less nurses? Is there less oncologists there now than there was 3 years ago?
So unfortunately, I don't have specific numbers on those front. Those are held by AHS, and I imagine are available to the Minister of Health. Certainly those are potentially questions that I may have the opportunity to ask the Minister when we go in for the budget estimates. We talk about the healthcare workforce strategy that the government claims it has and the investments it says it's making. But what we do know is the clear evidence of folks like Deb. Many others who have reached out to us who are telling us about extended wait times to see an oncologist. I've heard from frontline healthcare staff about shortages of nurses and others at crucial times at the Cross. So I know that Alberta Health Services is doing everything they can to plug these gaps. I know that all of the frontline healthcare workers, the doctors, the specialists, are doing everything they can to address the backlog and meet the demand. But unfortunately, they, over the last 3.5 years, have been put in an impossible position by this government that has attacked at many points, that has undermined them at so many others, and left them in a position where they are left with the moral injury of not being able to provide someone like Deb with the kind of timely care that they want to provide and that indeed she deserves.
Thank you. We'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's *9. Seeing none, that ends the press conference for today. Thank you.
Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.